If you have a Medicare Part D drug plan or Medicare Advantage that includes drug coverage, your prescription costs are changing in 2027. And for a lot of people, those changes are significant enough that doing nothing during open enrollment this fall could mean paying a lot more than you need to at the pharmacy next year. My name is Nathan Wright. I am a licensed Medicare advisor here in Hendersonville, just outside of Nashville, Tennessee, and I've helped hundreds of families navigate exactly this kind of change. I actually wrote a book on Medicare and retirement planning, and this topic is coming up in nearly every conversation I'm having with clients right now. So by the end of this video, you're going to understand what's actually changing with Part D in 2027, what it means for you and your out-of-pocket drug cost in plain dollar terms, and that one thing you should do before open enrollment closes to make sure your plan still makes sense for you. Hello there, and before we get into it, if you're new here, hit the subscribe button. I put new videos out like this every week to help people turning 65 get their Medicare right. Okay, let's start with the part that nobody's ever heard of because it never had a name before it made the news. For the last couple of years, there's been a federal program quietly propping up the price of standalone Part D drug plans. It's officially called the Part D Premium Stabilization Demonstration. Now, that's a mouthful, but all it means is the government was paying insurance companies a little behind the scenes to keep your monthly premium lower than it would be otherwise. You never signed up for it. You never even saw it on paper. It was just something in the background. And for most people, it made their premium look a lot more stable than it actually was underneath. That program ends December 31st of this year. Starting January 1st, 2027, insurance companies are setting Part D premiums without that extra help. So what does that actually look like in your budget? Roughly 3 out of 4 people in standalone Part D plans are expected to see some kind of increase. For about a third of those folks, it would be under $10 a month, barely noticeable. For a lot of others, industry estimates put it somewhere in the $11 to $20 a month range. That's not catastrophic, but if you're on a fixed income, it adds up, and it's not evenly spread. Some plans will even move a lot more than others, depending on how much they were leaning on that subsidy. The only way to know what your specific plan is going to charge is to actually look, which I'll show you how to do in a minute. Now, here's the part that's actually good news. Back in 2025, Medicare put a hard ceiling on what you pay out of pocket for covered prescription drugs each year. Once you hit that number, you owe nothing for the covered medications for the rest of the year. No matter how expensive your prescriptions are, for 2026, that ceiling was $2,100, $2,100. For 2027, it's rising to $2,400. If you're on 1 or 2 maintenance medications, you may never feel this. But if you're on something expensive, a specialty drug, a brand name medication with no generic, this cap is the single biggest financial protection Medicare has ever built into Part D. It didn't exist a few years ago. Now it does, and it's getting more valuable. Alongside that cap, there's something called the Medicare Prescription Payment Plan. And I want to be really clear about what this is and isn't, because I hear this one getting confused all the time. It does not lower what you owe. What it does is let you spread that $2,400 or whatever your actual out-of-pocket cost ends up being across monthly installments throughout the year. Instead of getting hit with a big bill at the pharmacy in January and February, when a lot of people fill their prescriptions early, same total cost, smoother pay path to pay for it. If cash flow early in the year is ever a stress point for you, that program is worth asking your plan about it. Now let's talk about the mistake I see more than almost anything else. Even if absolutely nothing changed in your health this year, same medication, same dosage, same pharmacy, your current Part D plan can still change on you. Every single year, plans update their formulary, which is just the list of drugs they cover and what tier each one sits on. A medication that costs you $15 a month in 2026 can get you moved to a higher tier for 2027 and suddenly cost you $80. Your plan can also change which pharmacies are in its network. None of this shows up as a letter that says, your costs are about to go up. It just quietly happens. And if you don't check, you could find out at the pharmacy counter. I get calls about this every single year from folks right here in Hendersonville, and it's almost the same story. A great fit, and it just isn't anymore. If this is helpful, I actually cover this and a lot more in detail in my free live Medicare workshop online. It's only about 30 to 40 minutes. It's completely free, and we go live multiple times a week. You can grab your spot at Medi65.com/workshop. The link is also in the description. So here's what I want you to actually do with this. Head to Medi65.com and click Shop Plans. Every medication you take alongside with the dose and how often you fill it, and let the tool show you what your real estimated annual cost would look like under different plans for 2027. Not just the premium, but the whole picture, deductible and all. So I'm not steering you here toward a specific plan. I just want you to be asking the right questions before open enrollment closes, because the plan that was right for you last year might not be the plan that's right for you now. And the only way to know is to actually check. Let's make this crystal clear before you go. The substance ending isn't a reason to panic. It's a reason to look. Some of you will check and find that your premium barely moved. Some of you will find a formulary change, and that matters a lot more than the subsidy ever did. Either way, it's worth checking. It's also important to mention here that if you're watching this video prior to October 1st, 2026, your 2027 plan will not show up until October 1st of 2026. Now, if you're watching after that date, it should be there already. Also, we specialize this in our office, so feel free to make an appointment at Medi65.com. We'd be glad to take a look at this for you. If any of this was useful, do me a favor and hit subscribe so you don't miss the next one, and share it with anyone you know who's turning 65 or is already on Medicare. That's exactly the kind of thing that's easy to miss until it costs you money. If you're turning 65 soon and you want all your Medicare questions answered in one place for free, no obligation, join me at my next live Medicare workshop. It's only 30 to 40 minutes, and we run it several times a week, so there's always a session coming up. Register at Medi65.com/workshop or click the link in the description. And if you want the free Medicare guide I mentioned, grab that at Medi65.com/book. I'll see you at the workshop.